Hello class, my name is Emily Parsons, and for this video I'll be demonstrating how to perform a proper eye assessment. The tools that are needed for this assessment include a Snellen chart and a pen light. First, the nurse will collect subjective data from the patient. According to Jarvis and Eckhart's book, Physical Examination and Health Assessment, published in 2023, the nurse will ask the patient the following questions. Have you recently had any difficulty seeing or blurred vision?
No.
Any eye pain?
No.
Any history of strabismus or diplopia?
No.
Any redness or swelling?
No.
Any watering or discharge?
No.
Any history of ocular problems?
Jaws.
Have you been tested for glaucoma?
Yes.
Do you have a family history of this?
No.
Do you wear glasses or contact lenses?
Glasses. Yes.
What is your prescription strength?
Honestly, I don't know.
That's okay. When was your last vision test?
Earlier this year.
Have you been tested for color blindness?
Yes.
Are you colorblind?
No.
Do you take any medication specifically for your eyes?
No.
Do you have any environmental conditions at home or work that may affect your eyes, such as dust, smoke, or chemical fumes?
Dust and smoke.
Do you smoke cigarettes?
Yes.
So my education for you would be that smoking is associated with age-related macular degeneration, cataracts, and eye inflammation. You should stop smoking.
I'm doing to work on that. Yes.
To start this exam, I will first inspect the external eye. The eyeballs should be aligned normally in their socket with no noted protrusion or sunkenness. Then I will take my thumbs and slide down the lower lids and have the patient to look up. I should notice that the eyes are moist and glossy. During this time, I'm also assessing the color of the conjunctiva and the sclera. The conjunctiva should appear clear with pink over the lower lids and white over the sclera. So I'll just have you look up. I'm going to take my thumbs and pull down. Everything appears to be within normal limits. Next, I will assess the pupils and iris using my pen light. I'll dim the lights and ask the patient to stare directly at my nose as I pass the light in front of each eye. There should be no opacities in the cornea, anterior chamber, or lens behind the pupil. The iris should appear flat with a round regular shape and even coloration. During this time, I will also assess if the pupils are equal in size, round, and reactive to light. I will assess accommodation by asking the patient to focus on a distant object and then have her to look at my nose. A normal response includes pupillary constriction and convergence of the axis of the eye. So I'll dim the lights. Just look straight at my nose. I'm going to look at both eyes. My light here. The pupils are noted to be equal, round, and reactive to light. They are 4 millimeters each. White light. Can you look at my iPad here? And then look at your nose. Everything appears to be within normal limits. Moving on, I'll be assessing cranial nerves 3, 4, and 6 following Newman's published article from 2023 entitled How to Assess the Cranial Nerves Neurological Disorders. This will test the extraocular muscles using the 6 cardinal position of gaze. I will move my finger left up, left down, right up, right down. The patient is to follow my finger using only her eyes. I will assess during this time symmetry of movement, globe position, ptosis, or twitches and flutters of the globes or lids. A normal response is parallel tracking with both eyes. During this time, I was also assessed for nystagmus, which is not a normal response. So I'm going to move my finger and just follow it with your eyes. Left, left up, left down, right up, right down. Everything appears to be within normal limits. No nystagmus was noted. Finally, I will assess cranial nerve 2 by using the Snellen chart to test visual acuity. According to Sprayberry's article published in 2021 entitled Snellen Chart, What It Is, How It Works, and a Printable Download, a normal size chart should be 20 feet away, but for this exam, I have a printout, and it's acceptable to be placed 10 feet away. The patient will cover one eye at a time and read the smallest line of letters that they can see. A patient must get 3 out of 5 letters correctly in order to pass the exam. 20/20 vision is considered to be normal. So I'm going to stand 10 feet away, and you cover your left eye and read the smallest line that you can see.
E, D, F, C, Z, P.
Okay, and then the next eye.
FELOPZD.
So the left eye appears to be 2050, and then the right eye is 2032. I note that the patient is not currently wearing her glasses or contacts, but if she were to, she could still wear them while reading the exam. You should really wear your glasses. This concludes the exam. Thank you for watching.